The COVID pandemic is far from over, with lockdowns extended in Australia and Indonesia and soaring rates in many parts of Africa. But already there are calls for the world to come together to make sure that we are better prepared for the next pandemic. The World Trade Organization is calling on G20 leaders to establish a global fund to address the future costs of any future pandemics. Well, according to the WTO, current public funding of pandemic prevention and preparedness needs to be doubled. Well, we can cross over to Venice to speak to the Director General of the World Trade Organization, Ngozi Okonjo-Iweala, who joins us live. Thank you so much for your time. Now, you've outlined a number of areas that you want to target, including the creation of a $10 billion fund. I just wonder, who pays into that? What kind of uptake do you have and appetite for this, given that governments are already spending so much in dealing with their own national crises when it comes to COVID?
Well, thank you very much, Kasia. I think that the $10 billion fund we're proposing is for the future, for future pandemic preparedness. So one of the things we are learning from this pandemic is just how unprepared the world is or was for the pandemic, and the fact that the COVID-19 pandemic is like a dress rehearsal for future pandemics, which may happen every 5, 10, or 15 years, as the case may be. So we're saying, in order to be better prepared, we need this $10 billion fund. And the G20 actually are the host of the high-level panel that came up with this recommendation, of which I'm a member. And we're saying that they should pay in, the global community should pay into this fund, 10 billion every year. It's tiny compared to the trillions that have been spent fighting the pandemic. It would help the world prepare to have better surveillance, so that we can prevent or deal properly with these pandemics. It would help to build health systems, strengthen the health systems, which have shown themselves to be very weak, to invest in manufacturing capacity so we can get a better supply of medical goods. And we're also saying that we need better governance. The global governance has been missing, and it's clear you need a multilateral approach that brings together finance and health to deal with this problem. So we're recommending also a global health threats board.
Well, I wonder just whether there is such an international appetite for this, given that we're seeing arguably vaccine nationalism. We're seeing countries really turning in on themselves and looking at their own citizens rather than looking at an international a way of dealing with this. And also, we are still really in the midst of this particular pandemic. Is it not a little bit too early to start talking about future pandemics?
I don't think so, Kasia, because this pandemic may become endemic. And we have to really start thinking of how to handle that, along with new versions and new variants that would come, which can mutate into another type of COVID virus and another pandemic. So it's now that we have to learn the lessons, and there's a bit of urgency. And the G20, I'm here at the G20 finance ministers meeting. They've received this report very well. They asked for it, and the Italian G20 presidency has, with the other finance ministers here, have said how useful the report is. And they'll be looking at the recommendations as we move forward and looking at how to implement this. There will be a meeting of finance ministers and health ministers coming together under the aegis of the Italian G20 presidency in October. And after that, there'll be the leaders meeting. And we hope that these recommendations, especially for the fund and the global governance mechanism, will be adopted.
I wonder if one of the ways to kind of deal with this on an international scale is to talk about the patent for the waiver for patents for vaccines. Is that something that you're going to be pressing for? Because arguably that is one way of speeding up the whole process and making it affordable for nations to get vaccinations to their citizens.
Well, you know that at the WTO at the moment, there's a debate raging about the waiver of intellectual property, and actually, it's beyond the debate now. There are text-based negotiations going on as members try to agree. But I think there are 3 elements needed. You need one to make sure that you have adequate manufacturing capacity, especially in emerging markets and developing countries. That is lacking in the world right now. You need supply chains to work so that inputs can get to where they're needed. For production, you know that for vaccines, the supply chains are very complex. And then you need transfer of technology and know-how, including finding a solution that is pragmatic for the use of IP. So all three elements are needed in order to overcome the supply scarcity of vaccines in the world and improve the inequity of access.
Well, it's a lot of elements, and I just wonder if I could just push on that, whether there is an international agreement, if there's an international appetite to get this done, and also when it comes to trade barriers, whether they come into play in hindering what you hope to achieve.
Well, what we've seen a little bit of is that when there are spikes of COVID in any country, they look inwards. And this is where they have barriers to exporting inputs of outputs. But I think in general, the recognition that this is a multilateral global problem and countries have to look beyond their own boundaries. If they don't solve it, I mean, there'll be mutations that will come back to even those who are vaccinated. So I think that is the realization that could happen is increasing the appetite to look beyond one's borders to solve this problem.
But given what we've been seeing, do you think that there is a hope when it comes to the way developing nations have been treated by richer nations in terms of getting access to what is needed in order to help citizens? Is there a general consensus that developing nations have done well, have been well treated by richer nations?
Well, absolutely not acceptable, the inequity of access to vaccines that we see at the moment. The good news about vaccines is that the world supply is increasing. In June, over 1.12 billion doses were administered globally, but only 0.2% of that went to low-income countries, only 1.4% to Africa. So you can see that the inequity in access is huge. And that, as I say always, it's not acceptable. So we obviously have to solve that problem. And it's getting people to recognize that just solving it within their own boundaries is not adequate. And I do think that the G20 ministers are realizing and recognizing this and stepping up. We're asking them to donate more, and there's a willingness to do that.
Thank you. Ngozi Okonjo-Iweala, Director General of the World Trade Organization, thank you so much for your time.